Welcoming a new baby is, well, it's just incredible. But it also comes with a ton of new questions, right? And one of the most common ones is about newborn jaundice. So this explainer is here to walk you through it, what it is, why it happens, and how it's handled, so you can turn any worry into pure confidence.
Okay, let's start with the first thing you probably noticed, that little yellowish tint to your baby's skin, or maybe in the whites of their eyes. If you're seeing that, I promise you are in very, very good company. It's something so many new parents notice in that first week.
And right off the bat, let's get to the most important thing, the good news here. The really good news is that for the huge majority of babies, this is completely normal. It's temporary, and it's one of the most common and easily managed things in the newborn world.
All right, let's dive in and really get what's going on. To understand that yellow tint, we've got to ask, what is actually happening inside your baby's brand new little body? So that yellow color, it all comes down to something called bilirubin. Think of it like a natural recycling byproduct. See, your baby's body is hard at work breaking down a ton of old red blood cells they don't need anymore. And when those cells break down, they release this yellow stuff. It's a totally normal and honestly a pretty smart process. This whole thing has a name, physiologic jaundice. And the key word there is physiologic, because it's not a disease. It's just a sign that your baby's liver, which is brand new to the job, is just getting up to speed on clearing out all that bilirubin. It's all part of the amazing transition to life on the outside. Okay, now for the best part, the part where you come in. Let's talk about the most powerful thing you can do to help. And it's simple, it's natural, and it's something you're already laser focused on, feeding your baby. The way this works is actually super straightforward. The liver packages up that bilirubin and sends it out mostly through your baby's poop. So the more your baby eats, breast milk, formula, doesn't matter, the more they'll poop. And the more they poop, the faster that bilirubin gets flushed right out of their system. Simple as that. In fact, you'll often hear pediatricians use this little mantra. Eat more, poop more, jaundice fades faster. It just perfectly nails it. It really drives home that frequent, good feedings are the #1 way you can help things along at home. Now, a question that comes up a lot, especially for parents on a surrogacy journey, is whether that changes anything. And the answer is a clear and simple no. Jaundice is all about the baby's own body, their liver, their metabolism. It has absolutely nothing to do with who carried the pregnancy. The care is exactly the same for every single newborn. Okay, so while you're focused on feeding, what are the doctors doing? Well, they have a really systematic way of keeping a close eye on those bilirubin levels to make sure everything is moving along just as it should. Here's a cool little insider tip. While we parents notice the yellow skin tone, pediatricians are often looking somewhere more specific, the whites of the eyes, which are called the sclera. Skin color can vary a lot, but that yellowing in the eyes gives them a much more reliable clue about what's going on. Now, are there some things that make doctors watch a little more closely? Yep. Things like being born a bit early, maybe some bruising from the delivery, or if feeding is off to a rocky start. This isn't a red flag for a problem, it's just your medical team being extra careful and protective. Think of it like a series of checkpoints. Your baby gets checked after birth, then there's a formal screening before you even leave the hospital. But honestly, the most important check is that first pediatrician visit after you go home. Why? Because bilirubin levels often peak a few days after birth, so that appointment is perfectly timed. So that brings us to the next big question, right? What happens if the levels are a little on the high side? And for families who've traveled, what does this mean for getting back home? Let's get into it. If your baby does need a little help, the go-to treatment is called phototherapy. It's basically a special blue light that shines on your baby's skin. It's totally safe, it's painless, and what it does is it changes the bilirubin into a form that's way easier for the body to get rid of. It works really well, usually bringing levels down in just a day or two. All right, we have to talk about this one. You have probably heard this from a well-meaning grandparent or a friend. Oh, just put the baby in the sun for a bit. And while there's a tiny grain of truth in there, the official medical advice is really, really important to hear. So let's be crystal clear on this. The American Academy of Pediatrics does not recommend using sunlight to treat jaundice, period. A few minutes of indirect sunlight, like indoors near a bright window, might offer a tiny bit of help for a super mild case, but it can never, ever replace medical phototherapy. It's just not powerful or consistent enough to be a real treatment. This is a huge question, especially for anyone who's traveled for their baby's birth. Is it safe to hop on a plane if your baby is still a little bit yellow? The short answer is yes, but only after your pediatrician gives you the all clear. They're going to want to see two main things. First, that the bilirubin levels are coming down all on their own without any therapy. And second, that your baby is eating like a champ, because that plain air can be dehydrating. Pro tip, always try to build an extra 2 or 3 days into your travel plans just in case.
So, what's the big takeaway from all this? Honestly, it's that you can feel reassured. Newborn jaundice is expected. It's something doctors look for in every single baby, and it's very, very manageable. By focusing on those good, frequent feeds and making it to your follow-up appointments, you are doing everything right. Look, every baby's story is a little different. This gives you the basics, but your pediatrician is your true partner in this. So we'll leave you with this to think about. That first week is just packed with questions. What's the most important one? You can ask your doctor to feel totally confident about your baby's unique journey. Keep that conversation going.